no two cases of menopause are ever the same. As women often are overlooked, often are forgotten when it comes to the perimenopausal, menopausal years. It's important we educate men because obviously they are not going through these symptoms, they never will, but they'll often live with somebody who does. Hello everyone, Well Menopause Day this year is Saturday the 18th of October.
Can we discuss a little bit about why it's an important subject?
It's an important subject because women often are overlooked, often are forgotten when it comes to the perimenopausal, menopausal years. It's really important that we raise awareness of this very important transition that women make in their lives into the menopause, and it's important that we discuss this with an honest and open conversation. It's wonderful that we're actually promoting this, and this is actually a day dedicated to this. It's not just a day, it should be the entire year, but it gives us the opportunity to allow us to promote, celebrate and discuss this further.
Tell us a little bit more about the menopause and the perimenopause. At what age can a woman expect her hormones to start changing?
Well, most women do find a fluctuation in hormones in their 40s. The average age for menopause in the Western Hemisphere is 51, but as we know, South Asian population, the age can be earlier, around 47. And it's within the sort of 7 to 10 years women start to notice a change in their periods, 7 to 10 years before their periods actually stop. Before that, they start to notice a change in their periods, which can be getting sort of longer gaps between periods, getting more heavy periods, getting sort of irregular periods is a very common symptom. So these are just sort of one of the symptoms that women sort of do understand is recognised as a symptom of the menopause.
And I think an important question I have is, why has it become a day of awareness?
I think it's become a day of awareness because we as a country, a population as a whole, have neglected women with perimenopausal, menopausal symptoms over several years. It really was when Davina McCall started talking about sort of, her myths of the menopause back in the early 2020s that menopause actually was brought to the forefront of discussion, and it was brought into the sort of sitting rooms of people where people started to actually have conversations about it. Before then, it was a very sort of a taboo subject that women felt a little bit embarrassed about talking to. Fertility is related to beauty, and youth is related to beauty, and when women reach their perimenopausal, menopausal years, it becomes a little bit more perhaps something they don't want to discuss openly. So it's great that you've got people like Davina McCall who actually championed a lot of the discussion around menopause and made it something that was a lot more freely discussed. And I think as a result of that, we need to keep reminding ourselves, men, population as a whole, that this is such an important stage in women's lives, and it needs to be discussed and it needs to be celebrated.
I completely agree. So another question I have is, why is it important to educate individuals, especially males?
Well, I would say it's important to educate everybody, Asiya, because there's a lot of misinformation out there at the moment. Everybody in their own mind is a menopause expert. And it's great that there's a lot of information, but there's a lot of misinformation. So actually making sure that you're getting your information from the correct sources, such as your doctor, your GP, your menopause specialist, is really important. It's important we educate men because obviously they are not going through these symptoms, they never will, but they'll often live with somebody who does, mother, sister, wife, daughter, eventually. So there are benefits to educating our society about what the perimenopause and menopause brings and what you can expect and how you can make changes to try and adopt to those changes that will be coming your way.
So naturally leading on from that is, what can a husband expect from his wife going through the perimenopause?
Well, I'd always say no two cases of menopause are ever the same, but broad categories, yes, there's a change perhaps in temperament, there's a change in mood. Mood can become a little bit more up and down, a little bit more labile. Anxiety is a really underdocumented symptom of the menopause, and I think a lot of women don't actually attribute their symptoms of anxiety to the menopause. I think they think it's related perhaps to something else going on in their lives. But anxiety is a big one. And so being aware that, your partner might feel a little bit more anxious, especially at certain times of the month or just generally. So, that's one of the symptoms. You might find that, a little bit more forgetful. We've talked about brain fog several times, and, women might become a little bit more forgetful in day-to-day dealings in life, taking the kids to school, work related, home related, and it's kind of understanding that and allowing that to be something that can be openly discussed without fear of feeling at all.
So they do sound a little bit frightening, the symptoms you've just discussed. I mean, I think it's really important we educate people about why those changes take place and what a lady can do to support herself during that period.
Yeah, absolutely. And I think one of the things that I would say to anybody is kind of, first of all, recognising that that's the problem. And that can be the hard bit, actually recognising that it's the perimenopause and not something else that's the change that's occurring within you. And I think once you actually recognise that's what it is, there are tests that we can do, there are, discussions that we can have, but recognising in yourself that these changes are taking place allows you then to seek help. Once you seek help from your GP or your menopause specialist, you will then be able to further have discussions about how to manage this. And obviously there's lifestyle changes that we discussed that you can have to manage your symptoms of the menopause. There's things like body identical HRT. Some women suffer with libido issues. There's testosterone, red light therapy, hyperbaric oxygen therapy, counselling, all those things that can help to support you through this time of your life.
And tell us a little bit more about the hormone changes that take place during this period that account for some of the symptoms you've just discussed.
Yes, so what happens over the perimenopause in your 40s, the estrogen levels start to decline, and it's the estrogen levels that then lead on to symptoms of what we call estrogen deficiency, such as hot flushes. Yeah. And 70% of women unfortunately suffer with hot flushes, so it's a really common symptom. We haven't talked about that one, but it's a very common symptom that women do experience related to reducing estrogen levels. And there's also a reduction in progesterone, and that can affect your mood, it can affect how you feel, and there's a huge reduction in your testosterone. And this is really underdocumented, so a lot of women find a massive change in their libido. So this can have a knock-on impact on your relationship with your partner. So, there is a genuine reduction in your hormones, and these hormones have, this reduction translates directly into how you're feeling in terms of your mood, hot sweats, energy levels, sleep deprivation, change in your hair, change in your eye, sort of dry eyes, change in your skin. So, there really is a direct impact of these hormones onto how you feel.
So there is light at the end of the tunnel, and I know we've spoken about this before, so I think it'd be quite useful if you gave us the top 3 tips for ladies going through this transitional period to make it as smooth as possible.
Absolutely. Well, I'll try my best. What I would definitely say, firstly, is recognise your symptoms, know your body, don't dismiss it. It's really easy to do that. It's really easy to say, oh no, I'm just having a bad day. Recognise it. Secondly, I'd say diarise it, put it into a diary, see what symptoms you're actually having, and go and see your doctor. It's great to have conversations with friends, with your mum, with your colleagues at work, but your doctor is the one who has the knowledge to actually help you through this. So please go and see your doctor, see your GP, see your menopause specialist. They will be able to help you. So those would be my top 3 tips.